How's it going, everybody? My name's Dan from Total Performance Physical Therapy, and I'm taking this opportunity today to kind of educate everybody on some of the myths that I've been hearing throughout the clinic this week, and I just kind of want to take the moment to set the record straight on a few things. So one of the things that I heard this week that I want to speak on that I hear quite a bit is, should you stretch a pulled muscle? Okay, so when we talk about injuries like a pulled muscle, a strained muscle, a sprained ankle, all of these different terminologies, a lot of them actually mean the same thing. So, when we say a pulled muscle, a lot of times we're talking about a strain. Now, it gets a little bit more nuanced in that there are grades to strains, so when we talk about a pulled muscle, we're really talking about kind of a low grade strain. Okay, so one thing I've heard a lot of times is, I shouldn't stretch a pulled muscle because it's pulled, right? It's already in that. And so the mechanism of the injury does not necessarily matter to the tissue that is injured itself. The body is going to react the same way. It's going to send inflammatory mediators to that area. It's going to send blood flow that's going to result in a bruise. And it's going to react the same way no matter if I pulled it or somebody hit me on the hamstring, for instance. And so the body's going to react the same way. And so in turn, we have to react the same way as well, right? So what is customary for an injury, an acute injury like that? What is customary is, 2-3 days of rest, right? We're going to ice it, we're going to rest it, and then after that, we're going to build it back up just like we do any other injury, right? So we're going to stretch it, we're going to strengthen it, right? We talk about lengthen and strengthen all of the time. And we're of course going to grade it up, right? We're going to build it up from the base, and we're going to take it easy just to within your pain tolerance. But just because you pulled the muscle, and that's our terminology, it doesn't really change how we're going to go about treating that. So I just wanted to set the record straight on that one. Okay, so the second thing, and this will be the last one I talk about today, but the second one that I hear all of the time is it bad that I'm feeling cracking or popping in my joints? So let's say, for instance, we're talking about the neck, right? One of the most commonly cracking joints in the body. But we get cracking all over our joints, and that can be a couple different things. But is it bad that I'm feeling cracking and popping? The general rule of thumb is, unless it's painful cracking or popping, you're generally okay. Now, that's not the end-all be-all, but again, rule of thumb here is, if it's painful, you don't want to do whatever caused that cracking or popping. If it's not painful, usually it is either the body is changing, right? So a lot of times it's productive because we are here trying to improve your mobility. And with that comes some changes in the tissue or in the joint spaces. That's going to create some different things in terms of gas exchange in the joint. And that's going to cause some sounds, cracking, crepitus that we hear all of the time. Same thing goes for popping, snapping, any of those types of terminologies or feelings, generally okay. Sometimes it can be some tight tendons or ligaments that are kind of snapping over joint surfaces that's causing that noise that you hear. Again, as long as it's generally not painful for that to happen, generally okay. Now, can you do it too much? Of course you can, right? So when we talk about the neck, if we're doing too much, then we can create a little bit too much mobility. Too much mobility could be a bad thing, right? Too much of a good thing can cease to be a good thing. So you want to do it in moderation, of course, but, and then go back in and strengthen it. But is it bad that I'm cracking? By the letter of the law, no. So we want to, kind of make sure that we're not doing anything in excess, but as long as it's not painful, again, we want to follow our pain rules, kind of do things based on whether or not something's causing me pain or relief. Is it general guidelines would be good at going through doing those things, but in general, no, it's not bad that you're feeling cracking and popping in your ankle or in in your knee, but it is telling us something. So if you are getting something like that, come on in to us and let's get it checked out, make sure there's nothing going on. And then, if you do end up pulling a muscle, come on in. We'll teach you how to do it the right way here at Total Performance Physical Therapy. Thank you so much.